Hi, everyone. Thank you so much for joining us today. We're going to give folks a couple more minutes to log on before we go over everything. If you're having any technical problems, please look at the slides that we have up on the screen right now. And again, we'll get started in a few moments. Thanks again for joining. Hello again, and thank you for joining us today on this webinar. We're going to get started now, but I wanted to go over a few technical items. If you are having any trouble with your audio and you're connected with your computer, you can change that option on your sidebar from computer to phone call. And then if you're using your phone, you'll have to enter your audio pin. The example in this sidebar is 100, but each audio pin is different to you. So if you're having any troubles with that, please go ahead and send us your concerns through the questions box. You can also use the questions box throughout the webinar to ask us anything about content material going on, or if you'd like to speak, you can raise your hand by clicking on the little hand in the red circle that's on the screen, and someone from our team will unmute you when it's time for Q&A. So again, thank you so much for joining us today, and I'm going to hand it over to Rebecca.
Thanks, Garrett. Well, thank you for joining us today. We're going to be talking about how Maryland has recently shifted their child care subsidy program to a private centralized case management system. And we're so excited to have Rene Williams here from the Maryland State Department of Education. And she's actually going to kick things off with an overview of the subsidy program in Maryland. And then I'll pick up and describe the study that we've just completed at Child Trends, working with the Maryland State Department of Education to look at how centralizing the subsidy program might be benefiting children and families. So feel free to enter your questions in the chat box. As they come to you, we'll have time for discussion at the end. And you can take it from here, Rene.
Thank you, Dr. Madill. On behalf of the Maryland State Department of Education, Elizabeth Kelly, Acting Assistant State Superintendent, thanks for your time. We can begin the review of Maryland's decision to centralize with the next slide. Parents on our subsidy program work or attend educational or training programs in Maryland, Pennsylvania, the Virginias, Delaware, or Washington, D.C. The red circles represent children and working parents that are the hands and souls of industries that provide food, clothing, safety, and comfort to Marylanders, and in some cases, the world. They are valuable to society and as their child's first teacher. The red dots numbered 1 through 24 also represent the local departments of social services located in Baltimore City and within 23 counties that comprise Maryland. A memorandum of understanding between MSDE and the Department of Human Services allows DHS employees to issue child care vouchers on behalf of MSDE. The blue dot represents Conduent, formerly Xerox, known as CCS Central in our child care community. CCS Central is a single vendor that contracts with MSDE to complete statewide provider payment, overpayment calculations, and child care authorization. The white star represents the location of MSDE, the CCDF lead for Maryland. More details about the subsidy program are on the next slide. The figurine represents MSDE. We provide administrative oversight to child care subsidy case managers in the 24 local departments represented by the red circles. Maryland is currently serving over 10,000 children on the state subsidy program, and we have over 4,000 eligible children on the wait list. A family size of 4 submitting an initial application will be waitlisted with income slightly over $28,000. A family of the same size would be ineligible at $35,702. Although Maryland had the 3rd highest state median income in 2016, there is a high price tag associated with living in Maryland. For example, housing in Montgomery County is comparable to New York City, New York, and the average cost of infant care in the same county is $1,400 a month. So with Maryland's subsidy rate set at the 10th percentile of the market rate survey, access to higher quality child care is often not an option for parents eligible on the subsidy program and for parents with higher income. The next slide captures the decision to centralize. The figurine on the left represents MSDE. Our administrative oversight is limited based upon case managers being located in 23 counties and in multiple locations in Baltimore City. Case managers that manage multiple eligibility programs are employees of DHS and have direct supervisory and administrative leadership that have separate bottom lines, separate mission statements, separate eligibility focus and output, and they do not report to MSDE, and they are not paid by MSDE. The figurine on the right represents MSDE having administrative oversight over one vendor in one location who only authorizes child care subsidy and is financially penalized if monthly service level agreements related to authorization are not met. Surely, when Maryland made the decision to centralize, someone had to ask the question, which is less problematic, 24 or 1, or 1 versus 24? Yet, another paramount reason for centralization is on the next slide. Maryland needed to delink, meaning to separate child care subsidy authorization from all other eligibility programs in order to increase continuity of child care. This slide depicts what often happens at the case management level. The figurine on the left is a case manager who manages 4 eligibility programs. It's her lucky day because child care subsidy has just been added to her caseload. Although child care subsidy authorization is 12 months, the case manager decides to align child care vouchers for 6 months with the other programs and will give the other remaining 6 months of the vouchers at redetermination. Although this is a good case management strategy, it is a strategy that could result in child care being ended prematurely. Reauthorization allows CCS authorization to be aligned with other redeterminations as long as the authorization is 12 months or when aligning, the clock for CCS authorization is reset for 12 months. Another example of delinking is on the next slide. On this slide, the parent fails to comply with TANF requirements, so the case manager ends child care vouchers until the parent complies. In Maryland, case managers often manage multiple eligibility programs and use child care vouchers as a carrot to get parents to comply with other eligibility program requirements. Maryland's decision to centralize was based upon the need to totally delink child care subsidy authorization from all other eligibility programs in order to increase or to decrease the interruption or delay of child care authorization. A final example of delinking is on the next slide. As Maryland continued to look at data, Maryland noticed voucher durations for 2 weeks, 4 weeks, or 2 months, often for the same child. As a result, the child revolved in and out of child care, in and out of child care. Delinking child care subsidy eligibility for all eligibility programs is and remains a very hard concept for case managers managing multiple eligibility programs to grasp and follow. As Maryland continued to look at data, our goal to delink child care subsidy in order to protect and promote the social emotional development of children was our goal. Maryland's path to centralization is captured on the next slide. In the fall of 2014, the federal government announced that reauthorization was coming. In October of 2014, with continuity of care being the major pillar of reauthorization, MSDE modified our child care system to have a soft default to 12 months. On August the 31st, 2015, Maryland fully centralized authorization. Like renovating a 300-year-old house, you can plan, allocate, and align resources, but until you get behind the walls and down to the foundation, you cannot truly predict the cost of the unexpected. On December 18, 2015, Maryland had to fully modify the full centralization model as depicted by the figurine on the left. The challenges with transitioning are on the next slide. Variation in policy interpretation and implementation. Maryland has one policy that governs the child care subsidy program. Upon full centralization, paraphrasing the Lowe's commercial which says, "I never knew there were so many different shades of blue." MSDE did not know the extent of the shades of policy interpretation and implementation within the local departments until centralization. The major difference was vouchers were being issued to clients before TTA was approved, but upon centralization, this practice was not followed because it was not CCS policy in Maryland. The difference in this policy variation gave birth to major problems to our centralization model. Culture. Parents and providers had a hard time accepting not taking off work to drop off documents, which never was CCS policy. Volume. Prior to the transition, the total calls received by the local departments throughout the state of Maryland were less than 6,000 per month. During the initial months of the transition, CCS Central received over 40,000 calls per month, with some parents just calling to see if somebody was there. Program priorities. Once centralization was announced, child care subsidy authorization was no longer a priority for many of the case managers at the local departments, so parents and providers were penalized. computer system. Not having system roles modified or restricted at the point of the transition had negative consequences on and after the transition. Human services versus automation. We underestimated the cries from parents not having a place to go that was familiar. Another visualization of transition is on the next slide. Prior to August 31st, we managed the 24 local departments. From August the 31st through December the 18th, we managed full centralization. The figurine in the blue dress represents Maryland's current structure, where we manage the 24 local departments that only authorize TANF vouchers, and CCS Central, which authorizes non-TANF vouchers. The bronze star goes to the figurine in the pink dress. The silver star goes to the figurine in the blue dress. This structure is not ideal, but Maryland has greater control over 2/3 of subsidies being authorized within the state of Maryland, and the gold star goes to the figurine in the green dress. Some of the benefits of centralization are on the next slide. Benefits of centralization: faster application processing. Right now, once CCS Central receives all documentation needed to process the application, they're processing the application in 7 days or less, whereas before centralization, it took anywhere from 20 to 30 days. Policy implementation and interpretation, easier training, TA, accountability, checks and balances is easier with one entity versus 22. Increased benefits to children. When applications are processed sooner, vouchers are issued sooner, and children can access childcare sooner. When continuity of care is increased, the child reaps the benefits. The challenges with transitioning to centralization are on the following slide. Automation. Maryland did not predict that the #1 preference for documentation submission by parents and providers would be the fax machine. Additional fax machines and dedicated lines had to be added to accommodate the volume. Change in culture. Parents and providers initially complained about the inability to drop off items. They had to be coached to trust the new process. Stricter policy interpretation. Expect parents to complain, and they did complain, if they were previously approved, not based on policy, but now they were being denied. Customer service balance and human touch. Even after 2 years after the modified centralization model, parents and providers still go to the local departments to get items faxed to CCS Central. People want touch. If Maryland did not have live customer service reps, our attempt to fully centralize would have been equivalent to the let them eat cake revolt. One size fits most, not all. The complexity of authorization will always require technical assistance from the CCDF lead in order for centralization to be successful. The benefits for centralization are addressed on the next slide. This slide demonstrates work completed by CCS Central in the month of July 2017. Data speaks volumes and tells CCDF administrators whether or not subsidy is being authorized in accordance with regulation. Knowing the number of calls, emails, correspondence tells a story about the health of the child care subsidy program in our state. Having the ability to access and review data is critical because the case manager is the drawbridge between the intent of reauthorization and the benefits of reauthorization reaching the child. What a case manager does or does not do and how they implement policy will determine if subsidy is being authorized in a manner that promotes stability and continuity of care or impedes positive social emotional development of children. Lessons learned are on the final slide. Know the history of CCS in your state. Was your agency the only CCDF lead? Knowing the past will help identify potential allies or adversaries before, during, or after the transition. Know the impact on providers. Providers are normally silent unless their payment is impacted. Do your best to make sure their payment is not impacted. Know components and barriers to the provision of seamless services. The closer centralization looks to the before picture, the easier the transition will be on parents and providers. Know everyone will not cheer your state's decision to centralize. If the slightest change is felt by most, before making a decision as tremendous as the decision to centralize authorization statewide, go ahead and buy stock in aprons, because tomato throwers will be encountered. The squeaky wheel gets oil, and it will get oil. If it's the sweet grandma that Facebooks the governor, or the parent that is $50,000 over income that tweets the politician, they will get oil. So resolve matters when only a drop of oil is needed. Know your why when faced with difficulty. Maryland's decision to centralize was to increase continuity and stability of care for children by having greater controls at the case management level. Case managers, again, are the drawbridge between the intent of reauthorization and the benefits of reauthorization reaching children. Maryland's decision to centralize was to have better controls at the case management level. In conclusion, as your state or territory makes decisions to increase the health, safety, and welfare of children, if Maryland looks like your paternal twin, we hope this webinar will prove helpful. Thank you.
Great. Thank you so much, Rene, for that overview. I think we all learn more every time we hear about what really happens on the ground. So fortunately, all of this was happening while Child Trends and the Maryland State Department of Education, or MSDE, were working together on a grant funded by the OPRE, Office of Planning, Research, and Evaluation. And that project is the Maryland Child Care Administrative Data Analysis Cooperative Agreement. The primary goal of this project is to use research to refine policies and practices related to facilitating greater continuity and stability, making services more family-friendly and supportive of child outcomes. So today, I'm going to be talking about how we've used our research to look at how centralization might be having that impact that they intended to have on continuity of subsidy receipt and ultimately on the stability of children's early care and education experiences. On the next slide, I want to give just a quick overview of what it looks like from the family's perspective. So Rene gave us a great overview of what it looks like on the administrative side. So in Maryland, to obtain subsidized childcare, a family must first establish their eligibility. And then once they're eligible, they need to obtain a voucher for each arrangement. The child would get 2 vouchers if they go to a center-based program in the morning, and then grandma receives a subsidy to watch the child in the afternoon. Okay, so these are the 2 key ideas we're going to be talking about in our research: is the eligibility for the family, and then the voucher that the child gets for their arrangements. On the next slide, I have some key definitions that we looked at in our study. First, we looked at the eligibility period length, and that's what Rene was talking about with the 12-month eligibility period, the length of time in days that a family is authorized to participate in the child care subsidy program. It can be up to 12 months, and as Rene mentioned, Maryland was pushing for more 12-month eligibility periods to prepare for the reauthorization of the federal child care program, subsidy program. The voucher, again, is that agreement for a specific child to attend a specific child care provider, and it's during a specific period of time. So the other element we're examining is the voucher length. That's the length of time and days that the voucher covers. A voucher could cover the entire amount of time that a family is eligible for child care, but it could cover a shorter amount of time. For parents who are in college courses, their voucher might just cover 4 months. It might cover 1 semester while the parent is in an approved education activity. On the next slide, I have just an overview of the research, why we would be looking at stability as an outcome. I think we all know stability is important, but focusing on child care, stability can be measured a couple of different ways. We can look at children just having fewer changes in child care altogether. So maybe only one arrangement at a time instead of moving between different arrangements in a given day. Or it can be looked at as a longer amount of time in a child care arrangement. So they're able to stay in their center-based care for an entire year. That's a stable arrangement. And stability has a lot of positive outcomes for families. We know that children develop more secure attachments with their caregivers when they're spending more time with them. Children in stable arrangements have shown fewer internalizing behaviors like anxiety. Children have greater cognitive growth when they're exposed to a high quality program for a longer period of time. And of course, parents can be more reliable employees when they have stable childcare. On the next slide, we wanted to show what is this interaction between childcare subsidies and childcare stability. On the downside, we know that children are most likely to leave the subsidy program when their eligibility period or their voucher ends. A child might end up leaving childcare altogether if their voucher ends, even though they would still be eligible for a subsidy. So if that semester ends, the child's voucher expires, even though the family is still eligible, that family needs to go to the office and request a new voucher. They might need a new child care provider, and all of that can lead to children to just exit their child care program due to the lag in getting their new voucher. So on the upside, having longer eligibility periods and vouchers may promote child care stability. On the next slide, we have the research questions we asked for this portion of our grant to look at the effect of centralization. The first research question was, were subsidy eligibility periods and vouchers longer after the shift to a private centralized subsidy case management system? And we're only looking at families not receiving TANF because, as Rene showed, the families receiving TANF went back to their local county offices in December of 2015. And then our second research question is on the next slide. And we asked, was there greater consistency across counties in the length of eligibility periods and vouchers after the shift to a private centralized subsidy case management system? And this also goes back to what Rene was saying, where each county might be doing something very different, even though Maryland has a single policy that they should all be following. So on the next slide, I have our data and sample for the analysis we've done. We've received child care subsidy administrative data beginning in 2007 through 2016. The data we get from Maryland is at the voucher level. So we know every single voucher that was given to a child from 2007 to 2016. We started with a sample of 650,000 vouchers. We've excluded almost half of those vouchers, mostly because they were for children who were receiving TANF, which again went back to their local offices. We also excluded vouchers that happened in a period of time we're calling during the transition, and I'll talk more about that later. So we've got about 350,000 vouchers that we've analyzed. Okay, on the next slide, just again, a repeat of research question 1, we were asking if the subsidy eligibility periods and vouchers were longer after the shift to Child Care Subsidy Central, because we would expect more of these 12-month eligibility periods and 12-month vouchers to be given out with one organization following the policy rather than spread out across counties. The method is on the next slide. We start with just a timeline. To put this into perspective, when did the changes occur? In October of 2014, we had a change in the computer system that the case managers used. Prior to October of 2014, case managers were manually entering the eligibility period, as Rene mentioned, and then in preparation for the reauthorization of the child care subsidy program, they made that a default 12-month period. And case managers could modify that if needed. If they didn't change anything when assigning an eligibility period, that family received a 12-month eligibility period. And that happened before the transition to a centralized case management system, which happened the following year in October. So on the next slide, I show how we've attempted to identify a before transition period and an after transition period, focusing around the transition to Child Care Subsidy Central, the centralized program. And the key decision we had to make here was identify the during transition period, because we had some great discussions with the Maryland State Department of Education trying to understand, could we use October 31st as a cutoff date? And the clear answer is no. Things were in flux well before the transition to CCS Central, and definitely after, as they had thousands of applications pouring in at once. They needed to catch up. So working with our partners, we determined that June 2015, prior to centralization, was the beginning of a period of flux, and we wouldn't want to consider those data. And that would continue until February of 2016, following centralization. And that's when things were up and running as we would expect them to be as a centralized provider. And on the next slide, we show the three blocks of time that we look at in our descriptive analyses to see whether things were operating differently after centralization. In 2014, we picked the vouchers that were administered from March through October for two reasons. One, because that is the same time period we have after the transition, March through October. So by looking at this same set of months, we don't have to worry about the effect of school year. So kids tend to get shorter vouchers just by virtue of them happening in June because they're getting summer childcare. The second reason for selecting that March through October is because the shift in the computer system happened at the end of October, when that default value was assigned for an eligibility period to 12 months. In 2015, we started in January, and then we stopped at May because that is when we determined things were really in flux. And then in 2016, we have as much data as we have from March through October to look at the after transition period. Okay, on the next slide, we have some of our descriptive results, looking at the length of the eligibility periods. And remember, Maryland was really wanting to see 12-month eligibility periods. Here you can see on the x-axis, these are the lengths of the eligibility periods. You can see a spike at the 365 days or 12-month eligibility periods. In 2014, 24% of all eligibility periods were 12 months. On the next slide, we show 2015. There is a big increase in the percentage of eligibility periods that were 12 months during this time period, from 24% up to 38% in 2015. And remember, this is before centralization had even happened, but after that change in the computer system to the default value. And then in 2016, after centralization, just as we would expect, most of the eligibility periods during this time were for that 12-month period of time, 72%. The next slide puts these three time periods next to each other. And you can see that there was a gradual increase. And using our statistical analysis, we know that after centralization, eligibility periods were significantly longer after the transition to Child Care Subsidy Central, but they were also getting longer by 2015. Okay, and then the next set of slides takes a very similar approach, but looking at the voucher. So that's that child's kind of ticket for childcare for a particular childcare provider. And those tend to be shorter because they can end when the parent's approved work activity ends, like their college semester, at least during the time period of our study in Maryland. So in 2014, you can see, looking at the voucher length, there was a spike in 6-month vouchers, and then another spike in 12-month vouchers. 13% of the vouchers during this time were 12 months. The next slide shows 2015. And during this time period, we also saw a spike at 6 months, but a little bit more, 17% of vouchers during this time were 12 months. So we didn't see this big increase in 2015 like we did for eligibility periods. And then moving to 2016, we saw what we wanted to see. Almost half of the vouchers during this time period were for 12 months. We wouldn't expect to get anywhere close to 72% because it was dependent on the work activities of the parents or a school-age child only needing a summer voucher. So it's a great improvement to see 42% in 2016. The next slide, again, puts them next to each other just so you can see how the length of the vouchers has shifted over the past 3 years. And then in regression analyses where we controlled for child characteristics and the time of year that children were getting these eligibility, these vouchers, we know that this increase in 2016 was significant. So vouchers were significantly longer after the transition to centralized childcare. Okay, on the next slide, we answered another question we have, which was, were vouchers covering the full length of their eligibility period? If a family is eligible for 12 months, but their voucher is only for 3 months, that still means that they have to go back to their subsidy office or go back to CCS Central and request a new voucher. Before the transition in 2014, 45% of vouchers were as long as the eligibility period. In 2015, it was actually fewer, only a third covered the full length. And we know that's because eligibility periods were increasing. Many of them were already at 12 months, but vouchers were still being assigned to be quite short in 2015. And then after the transition in 2016, more than half of vouchers were covering the full eligibility period. So once a family received, a 12-month eligibility period, most of those families would also get a voucher that would cover them for that full length of time, promoting a stable childcare arrangement for the child. Okay, the next slide goes to our second research question, which was asking about greater consistency across counties in the length of eligibility periods and vouchers after the shift to CCS Central. And we really expected that this would happen because it's centralized, so there's no effect of the county. But then, as Rene mentioned, families were going to their local offices and asking for their documents to be faxed to CCS Central because the local offices were familiar to them. So we did want to make sure that in centralization, families' experiences didn't depend on the county that they lived in. So on the next slide, we see in 2014, each county in Baltimore City is on the x-axis. On the y-axis, we see the average eligibility period length that was assigned in that county, starting from counties giving the shortest eligibility periods, which was Garrett and Frederick counties, moving all the way to Caroline County, which had, on average, 12-month eligibility periods. So that inconsistency right here is a main reason we wanted to look at the effect of the program and why Rene was talking about the importance of centralizing, making that experience more consistent for families. So the next slide shows 2015, these light blue bars. And you can see this is even before centralization, before the transition to centralization. And since eligibility periods were trending towards 12 months at this time, we were already seeing much more consistency across counties. And on the next slide, we see 2016. Those are the orange bars. Most of them are very close to a full 365 days, 12-month eligibility periods. So on the next slide, we show that the consistency had definitely increased by 2016 for eligibility period length. And then the next slide looks at vouchers in the same way that we looked at eligibility periods. So as we showed earlier, vouchers tend to be shorter because they're for that specific arrangement. And here, Frederick County had the shortest vouchers on average, and then Allegheny had the longest on average in 2014. The next slide shows 2015. And this is in contrast to the eligibility periods, because in 2015, the vouchers were not getting much longer, and they were not showing increased consistency across counties. But in 2016, on the next slide, we can see that after the transition, we saw longer vouchers, but also increased consistency across counties. So Frederick was now giving vouchers that were very similar in length to, Somerset, Queen Anne's, and Allegheny County. And on the next slide, we just show that there was more consistency across counties in the lengths of their vouchers. And then the next slide takes a slightly different approach. What we really wanted to know is how much better did things get from a numbers perspective. We like numbers, this is research. So what we know is that in 2014, just knowing what county a family lived in told us very good information about how long their eligibility period or their voucher was likely to be, just by knowing their county. So in 2014 and in 2015, just knowing a family's county explained 11% of the variance in the length of a family's eligibility period. And then the next slide shows for vouchers in 2014 and 2015, the county explained 8% and 6% of the length of the voucher. And then those orange bars show how much county explained the length in 2016 after centralization, and it's 1%, it's almost nothing. So now a family's experience with the eligibility period they get and the voucher that they get really has nothing to do with the county that they're coming from. So that was great news for Maryland. Okay, so on the next slide, we've taken our findings for Maryland and tried to pull together some recommendations for CCDF administrators and researchers. But I just want to reiterate that these are specific to our findings in Maryland. So we would love to hear what others are taking away from the findings we've got in Maryland. So hopefully we can have a good discussion after this. The next slide starts with our ideas for CCDF administrators. Number one, ensure that the administrative procedures are aligned with the federal regulations for the subsidy program. So what does that mean? We're taking from our finding that once Maryland changed the computer system for assigning eligibility periods, rather than having case managers enter it manually, it shifted to a default 12-month period because that was Maryland's policy to administer 12-month eligibility periods. That's when we saw eligibility periods get longer. So CCDF administrators can look at their policy and ask if the paperwork or the forms that case managers are asked to complete might actually make it harder for a policy to be implemented on the ground. Make it harder to give 12-month eligibility periods because you're leaving it to the case manager's discretion. So consider places where you might assign defaults or automate. Number two, assess the variability in subsidy receipt at the county or local level. Obviously, we saw in 2014 that the 12-month eligibility periods were not being implemented the same across counties, and that's what led us to look at why might this be happening. We know it was because the policies were not being implemented the same in every county. So different places who are, other states who are having local management of their subsidy program should ask whether families' experiences are differing across their state. And then finally, on the next slide, we have consider how a family's participation in other eligibility-based programs affects their experience with the subsidy program. Renee's visual was so great, showing how a family who wasn't following on their TANF, their Temporary Assistance for Needy Families, participation might have been dropped from the subsidy program, or their eligibility period might be shorter because the caseworker wants to streamline case management. All of those would have a negative impact on the family's experience with the subsidy program. It could give that child a shorter subsidy just because of what's happening in their other eligibility-based programs. Now, with reauthorization of CCDF, this is less of a concern because the eligibility periods need to be 12 months. But there are a lot of other considerations to consider when you have families who are receiving, 3 or 4 or 5 different social programs and having many interactions with their case managers. Okay, on the next slide, we just have some ideas for researchers. Something that's really benefited us is at regular intervals throughout the project, include individuals who are involved with day-to-day management of the child care subsidy program. From the beginning of our project, we would discuss with MSDE to understand what are the best research questions we should even be asking that can help them. But then when we showed the preliminary results and we said, why are we seeing longer eligibility periods in 2015 before centralization? And that's when we learned about the change in the computer system for a default value of 12 months in the end of 2014. So our interactions with the Maryland State Department of Education really helped us interpret our findings correctly. And second, on the next slide, carefully define transition periods when studying program activities before and after policy changes. We knew that the centralization happened on October 31st, 2015. And it was through our discussions with Maryland that we learned, oh, things were already starting to change, by June. And then it really took a while for the centralized system to ramp up for a few months. So we had to kind of balance the need to remove biased data, but not throw out too much data. And all of these decisions were made just through discussions with MSDE and really making a lot of best guesses. So we would love to hear from others who have experience defining transition periods when a policy implementation had more of a fuzzy timeline. Okay, so now on the next slide, we just would like to start our discussion. And then on the next slide, I have some prompts. So first, we would like to hear from administrators. These are just a couple of ideas for things we would really like to hear from you all, but we're open to other ideas or questions as well. So questions for Rene about the process of centralizing in Maryland. What are your experiences with delinking or centralizing social programs? And what resonates with you about the findings in Maryland? So feel free to raise your hand if you would like to talk, or type in your answer or your question on the chat.
Hi, Rebecca. We had a good question come in during the presentation that I'd like to pose for Rene. The question was, have parents been interviewed to know if they have welcomed this change, and referring to centralization, and what has their overall response been about centralization?
Could you repeat the question one more time?
Of course. So the question was, have parents been interviewed to know if they have welcomed the change of centralization, and what has the parents' response been to centralization?
Okay, so interview, no, because I would take that to mean that some type of survey form would have been sent out. And in reference to their response to centralization, for the most part, it's been great. But of course, we do have parents that have some concerns when they can't get in contact with a case manager. Because before centralization, parents had an assigned case manager. the process that's used by CCS Central, they don't assign a case to a case manager. The process there is fully automated. So it's paperless. So when vouchers are issued, they're issued in the name of CCS Central. So the majority of the concerns that are expressed by parents and providers, they normally can be summarized by the fact that they want to have a specific person that they can reach out to when they need to reach out to someone.
That's great. Thank you so much, Renee. And this is a very similar question that I think you could answer as well. But the question is, what do you contribute the reduction of processing time from 20 to 30 days down to 7 days? I think you touched on it a little bit, but just discussing kind of the different factors that go into the reduction in time.
I think that's an excellent question, as well as the first one. But I think the main reason is that the system that they have set up at the process that they have set up at CCS Central, when documents come in, they're scanned into a system, and the documents go into a queue. So whatever queue is available, a person processes it. If you look at how work is done at the local level, it's assigned by caseworkers. So if a caseworker is on vacation, nobody processes the work. If a caseworker interprets policy, the policy says that the parent has 30 days to complete the application process. But if the worker interprets the policy to mean that they also have 30 days to complete the process, instead of them, they may have all the information on day 10, but they may decide to wait until day 25 to process the work. So because CCS Central doesn't have case managers assigned, the work comes in and it's finished. In addition, we have a service level agreement that, and I don't want to quote any because I don't know all of them by heart, but they have X amount of time to look at an application. They have X amount of time to process the application. And if they don't meet those deadlines, then they have to pay us back money at the end of the month. So I just think that mainly the real answer is the way their system is set up, and what the term that they use a lot is, we don't have one point of failure. So that means we don't have our work sitting on the desk of one person. Anybody that's in the eligibility unit is capable of processing an application.
That's great. Thank you so much, Renee. So another question that came in, I think, is for Rebecca. The question is, do your results support the interpretation that changing the computer system default to 12 months in 2015 had an impact on eligibility length equal to or greater than centralizing the entire system?
That's a great question. And we actually can't conclude that it was the default length that impacted eligibility periods, because Maryland was really pushing for 12 months eligibility periods in a lot of different ways. They had brought it up at staff meetings, encouraging case managers to use 12-month eligibility periods. But we do feel like the default value, we know from behavioral economics, can really make a big difference in the decisions that, or in the actions that case managers use. Let me think, I would say that looking back at the eligibility periods, I'm going to go through my own slides and just to see what the change was. So we went from 24% of eligibility periods being 12 months in 2014 to 38% in 2015 after the default, and then up to 72% in 2016. So based on just our descriptive data, it still looks, and we're not saying anything causal, but it looks like centralizing still made a big difference in the use of 12-month eligibility periods. But I think this is a great opportunity for me to say that a lot of things have been happening from 2014 to 2016 in the push for 12-month eligibility periods. So unfortunately, it's hard for us to nail down one cause versus another cause. So I think that they really work together. Okay, feel free to bring in more questions for Rene or myself about the administrative side of things, but for researchers, also administrators, we have questions. Have you found administrative practices to sometimes be misaligned with policies? If so, what? This is in reference to the finding that despite our 12-month policy in Maryland, the practices on the ground were not to give 12-month eligibility periods. Have you been doing similar work? What have you learned? And do you have questions for us regarding the findings or process for this study? Maybe
we have a raised hand, so I'm going to turn it over to Sandra Meyer. And Sandra, you're now off.
Thank you for letting us ask a few questions. So one of our staff here, we were wondering if there is a place where the parent, since it's a little less human touch, that they can check on the progress of their application, or if they're missing any component that they need to provide for documentation.
Yes, they can call in through the automated voice system and find out where their application is in the process. And they can also call in and talk to customer service as well.
I'll also mention that if you're thinking of questions that you have, we will be having a report that'll be posted in a few days coming from this project, as well as a short summary document that's more for a non-research audience that'll be posted on the Child Trends website. We'll have all your answers to the nitty-gritty research details there. Yes, and the link will be in your webinar email.
All right, we have time for one more question, I think. And this question is, what was the best lesson you learned about the culture shift to 12 months?
That's a question for Rene.
Best lesson learned about the culture shift to 12 months. Wow, that's a good question. I just think that I came out of a meeting prior to this seminar. It was with case managers. And even though we had a meeting at the supervisory level in October to talk about 12-month vouchers, the meeting this morning was with case managers. And case managers, these case managers were from the local department. And they were in shock when they found out that they were not supposed to be issuing vouchers based upon the participation activity of a parent, that they needed to issue the vouchers in reference to 12 months. So when I looked at the research that was provided by Child Trends, I was very excited by the findings, because it helped me to see what was really happening, what I thought was happening, but I needed to see it in reference to numbers. So in reference to the change, I'm glad to see that the voucher duration is increasing to 12 months. what the data also suggests to me is that we still have work to do. And like I said in the presentation, and after looking at the results, having centralized childcare is so much easier to get a message out when you have to only talk to one person and everybody goes by the same information. And I'm excited to see that Maryland is issuing more 12-month vouchers. So I think just to know that it's happening and that it benefits children, that's the best thing that I can say. I don't know how to get out of that.
Rene.
Well, thank you, Renee and Rebecca and Nadia, and for everyone for joining us on today's webinar. Like Rebecca was saying, we'll have a page that has the report information, a link to this recording of the webinar, as well as a PDF of the slides, and that information will be coming to you in an email next week from GoToWebinar. So just keep an eye out for that. If you have any questions, please reach out to us, and thank you again for joining us today.